Joining us now on Bottom Line is Donald Genzig, the president and CEO of WakeMed Health and Hospital. Don, thanks for being with us today.
My pleasure.
You've got kind of an interesting background, a retired rear admiral, and now you run a very large hospital system in the state. Tell us a little bit about your background.
Well, certainly. I grew up in a healthcare family and helped run health systems in the private sector. Around the same time, I was approached by joining the Navy, so I raised my hand and joined the Navy Reserve and did my 2 weeks a year and a weekend a month that gradually turned into much more than that. And then eventually, after 22 years, I received a phone call that the President of the United States has nominated you to be a Rear Admiral in the United States Navy. And so I left my job in the private sector running hospitals in Nashville, Tennessee, and came on active duty. And 3 years turned into 5 years, turned into 8 years. And so I've run both health systems in the private sector. I've run health systems within faith-based organizations. And I had the great honor of helping lead Navy medicine during one of its critical times as the conflict continued to grow.
Well, WakeMed, one of the larger public hospital systems in the state. Tell us a little bit about the size and scope, how many patients a year, those sorts of things.
Certainly. WakeMed's been around 56 years. It is a gift of the community, started by the community to care mostly early on for those that couldn't get care anywhere else, and it's grown into the largest deliverer of care in the largest county, I think the numbers show, in North Carolina. And so we're about a $1.2 billion health system if dollars and revenue are our measure. We have about 9,000 committed team members. We have about 1,200 physicians, about 1,200 volunteers. We have probably over 1 million patient encounters a year. We're all over the county, and 65 locations, 3 hospitals, a surgery center, multiple emergency rooms and diagnostic centers, and within WakeMed we take care of about 300,000 emergencies a year. Wow. The trauma center, you know, we're a big place.
Yeah. Mr. Genzig, let's talk a little bit about what sort of transpired just a couple of weeks ago. The Carolinas healthcare system and the UNC healthcare organization are apparently calling it a marriage.
Not a merger.
Not a merger, but a marriage, whatever you may call it. And they stress the fact that just like every acquisition, that there's going to be cost savings, and especially important is access to rural health will go up. What are your initial takes? You probably don't know the detail because, frankly, nobody does. It has to go through a process. But what are your initial thoughts about what they say, the cost savings part as well as the access to rural health?
Well, I think it becomes very fashionable to do that. Bigger, by definition, can be better. What I haven't seen is the overall result nationally that the biggest healthcare systems are the lowest cost, well, especially to the patient. Right? They might be the lowest cost in how they operate, but not much of it that I've seen analysis show makes its way to the patient. That said, there are obvious economies of scale. We have more economies of scale than a standalone rural hospital, and so you understand why they start to take a look at it. And if their focus really is on improving access and driving value and lowering costs and improving quality, there can be some benefits. There tends to be, what I've seen is when you get to healthcare, in my opinion, is local. Who better to make decisions for the healthcare needs of a community than the community itself? And so sometimes when you grow beyond your supply lines, both in the military or you tend to lose that ability of boots on the ground and eyes of the community making those decisions. So there's going to be some challenges along those lines, but in theory, it's possible.
Does this put any pressure on WakeMed if this were to go through and end up being a full merger to grow or partner itself with a Duke Healthcare or any other sort of similar size competitors in the healthcare market here in North Carolina?
Well, UNC was not a baby before so WakeMed is the largest in Wake County, but we're in a wonderful healthcare environment in the Triangle, and so we focused on partnering and collaboration. Then we have abdicating the control to another entity, and so for us, we partner with Duke around hearts and cancer, and we work with UNC around education and training of physicians and residents and so forth, and we'll continue to do that. UNC didn't suddenly get a lot of money as a result of this thing. They've been a $3+ billion enterprise, and Duke's multi-billion, so we've had some pretty sizable
And frankly, sort of WakeMed went through this a few years ago. I'm not sure if it predates you or with Rex, I believe, or is this a trend? I mean, just looking at it on a national perspective, do you see hospital systems merging because they're trying to figure out how to cut costs in their operations because there may not be enough margins in terms of whether it's dealing with insurance or the physicians going like our reimbursement rate, we don't get paid enough.
I think that can be some of the driving factors. I tend to think we're in year 25 of a 40-year transition within healthcare, and none of it has been encouraging higher cost. All right, I haven't had anyone say healthcare just doesn't cost enough. We think you guys need to drive up the cost more and lower quality. So we've focused as a nation on how we can improve outcomes and figure out how to make healthcare more affordable. Some think that by getting bigger you can do that, and in some ways you can. I think that WakeMed has the perfect scale at this point to be able to do that. We're big enough in a wonderful community to be able to focus on the needs of Wake County, and I'm proud to say Wake County is the healthiest county in North Carolina. Still have a lot of work to do, a lot of factors to work on, but we haven't felt the pressure or the need to not meet our mission of improving the health and well-being of the community by growing exponentially along those lines. We're growing steadily on our own and really focusing on improving the population's health in our community.
In the final 30 seconds here, lots of conversation about health care nationally. Fits and starts in Congress are trying to address this issue. Now, Senator Bernie Sanders has talked about a single-payer system. What are your thoughts? What do policymakers need to understand about health care and the provision of medical services to individuals? So, final 30 seconds.
Well, I think the bottom line is still focusing. Being healthy costs less than being sick. And so how you balance engaging the individual and the communities and technology and the pharmaceutical industry and healthcare providers to both balance the needs today with being able to prevent illness, injury, and disease in the future. And that's the ultimate sweet spot.
Donald, thanks for joining us this week.